Appreciate that. All time has expired. I appreciate Mr. Reed's concern about the need to save Medicare. The clock is ticking. We need to act now, Republicans and Democrats. I don't see that as frightening. I see that as a genuine concern for a program that's in very severe financial straits. To try to bury our heads in the sand is really the wrong thing for our seniors. I think the only scare we heard was the witnesses claim that Republicans want to end Medicare as we know it. Didn't that win the national award for the political untruth of the year just 2 years ago? Maybe we'd be better off if we actually came to the table together, figure out how we're going to save Medicare, rather than throwing out what everyone knows has been discredited. And to that point, I'd be cautious about claiming that the slower growth in health care costs come from Obamacare. Independent experts don't say that's the case. In fact, many of them believe that's because this is the worst economic recovery in 70 years. 20 million people can't find a full-time job. Millions more have just given up looking for work. It's Jimmy Carter days for them. And since the bottom of the recession, you're more likely to be forced to go to food stamps to feed your kids than actually find a new job. And so it's clear that if you can't find full-time work and you can't feed your kids, my guess is you're not going to the doctor. That's what's more likely slowed the growth in health care. So I'd be cautious at a time when the stimulus claims were exaggerated and the sequester claims were exaggerated. I think on health care, let's stick to the truth. On this point, and Mr. Chairman, I believe you were recognizing me. I apologize while you stepped away. Online, this is the marketplace timeline for the exchanges, and that's for the public as well as lawmakers to track how the exchanges are on track. But as I look at it, what I see is deadline after deadline missed. It's as if the agency is in disarray trying to meet the October 1st deadline. The final market rules regulation was missed. The payment notice rule was missed. The business rules for information technology, that's 2 months delayed. You recently announced a delay in the choice option for small businesses. You've also delayed the basic health care plan for year 5 of it. And so these delays are having real impact. Real people are concerned about these delays, and the failure by the agency to meet these deadlines raises real concern. So my question is, do you have a plan B? Do you have a contingency if the exchanges are not ready, up and running with a fully informed public by October 1st?
As I answered before, Congressman, we will be open for open enrollment October 1st of 2013, and we will be enrolling Americans across the country January 1st, 2014.
So at this point, you've had no discussions within the agency on contingency plans?
Well, we have lots of contingency plans
for not meeting the October 1st.
No, we are determined and on track to meet the October 1st deadline.
So you can assure this committee there will be no further deadlines missed, no further delays in the implementation of the exchanges?
We are on track to meet the October 1st deadline.
The question, again, because I think we're all concerned, Republicans or Democrats, you can assure us there'll be no further delays.
I can only tell you what I'm telling you. We are on track to meet October 1st. I can't tell you what exactly will happen at every step along the way, but I can tell you that is the determination. We are on track to meet it. We test it.
Well, you're not on track to meet it. That was the question.
Pardon?
You're not on track to meet it. You've missed deadline
We are
after
on track
deadline.
to meet the October 1st deadline. Yes, sir.
So there will be no further, and again, I'm just trying to get to the bottom line. There will be no further deadlines missed, no further delays.
Again, I don't know quite what that means. Will a rule and reg be a week later than it might say on the paper? It could. We will be open for business October 1st.
So, no delays. That's great news. No further deadlines missed. That's great news. We're still waiting as small businesses for information on the business information notices 2 months late. Is that being delayed again this week, next week? So are we seeing another ongoing delay there?
I think, sir, that is not ours. It's the Labor Department's notice, but my understanding is it's imminent. That is not an HHS rule that's coming out.
Okay. Thank you very much, Madam Secretary.